Hello, everyone, and welcome to today's SciComm COVID-19 chat. We are super honored to have Krishana Sankar with us today. Krishana does many things, okay, to say the least. A researcher, entrepreneur, okay, and she lives in Canada. And so I've been inspired by her work and just seeing what she's doing with COVID-19 right now. I knew that we needed to talk to her and get an update on what she's doing. How did it come about? And take a little survey of that. So Krishana, welcome so much. We are honored to have you today. Could you just add a little bit more about yourself before we get going?
Sure. Thank you so much for having me, Fenwell. So, it's Krishana Sankar, and I have a PhD in molecular cellular biology and physiology and diabetes research. I'm also a science communicator, so I've been communicating science to different audiences from children as young as 3 years old to adults within the both in real life, so locally, nationally, internationally, and also on social media. And more recently, I am the communications lead and part of the operational strategy team for a platform called COVID-19 Resources Canada. And so that is a response to the COVID-19 pandemic that we're currently facing.
Yeah, it's fantastic. And so you guys have recently put out a big database, okay, that has been released. Can you tell us about that, the genesis of the project, and then we'll dig a little deeper in terms of the components of it.
Sure. So COVID-19 Resources Canada is essentially an online centralized hub that was brought from Dr. Tara Moriarty and Dr. Guillaume Bourque. So they're two professors at University of Toronto and McGill University, respectively. And so Dr. Tara Moriarty started with a volunteer form that she created with to get people on board for volunteering because of lack of resources within this pandemic. And then Dr. Guillaume Bourque started a database for reagents. So for reagent exchange between the different diagnostics and the different labs that require reagents during this time, just because of the lack of supply and resources. So they both actually started communicating on Twitter, and that's where I saw the conversation happen. And so I really wanted to get involved in any way that I could. And so I contacted Dr. Moriarty, and very quickly after that, a team of several volunteers from multidisciplinary backgrounds came together, and we started to create what is now COVID-19 Resources Canada. So it all stemmed from social media, particularly Twitter. And so Dr. Moriarty came at it from the angle of looking at places like Germany and South Korea and seeing them have a certain preemptive approach to this pandemic. And she thought that it would be really useful for Canada to have something similar to what those countries have. And so that's kind of how the idea of the platform started.
Okay. And the platform, like in terms of who's the audience in the platform, who's the audience here?
Yes.
Yeah.
So this platform is geared towards the non-expert public, so the community that are non-scientists, healthcare workers, and also for scientists and for public health. So we've got several different audiences for different things. So for example, for the science experts or the healthcare workers, we've got the database for volunteers. If they have specific skills and skill sets that are needed within those particular industries, we ask people to sign up on the volunteer database for that. So we've gotten several requests for people to help within, for example, long-term care homes. And so that's because of the lack of resources that we have within our particular province and also within the country. I'm sure the same there in the United States. And so that's one way in which those experts can help, but then also for the community and the non-expert people who want to assist in any way possible. So for example, if they're making masks or they want seniors in terms of buying groceries and giving and delivering groceries to seniors, because that's also there are a couple of things, but then also on the information side. So like I mentioned, I'm the communications lead of the initiative. And so when it comes to information, for me personally, that was a huge part of it. And on a personal side, started to notice on social media lots of information being shared, especially by my Guyanese community. So I am Guyanese Canadian. And so I thought it was really important for me to be able to tackle misinformation in that way, going out on social media and talking to people, engaging in conversation around the different things that they're sharing and how they may be inaccurate and why they may be sharing it. Because it's a difficult time. People are stressed and they're grasping for anything to help because we don't currently have any cures or any treatments. And so having that in mind, one part of our platform is actually dedicated to collating lots of different resources. So first of all, trusted resources for people to actually go to the platform and learn about not only scientifically about COVID-19, but also medically. One of the things that I noticed within this pandemic is although several groups, whether they be nonprofits or government or academic, problem is everything is so scattered. All the information is everywhere. So our aim was to create this centralized hub where we can collect all this information from the different groups that are doing such amazing work and be able to help redirect people to specific places where they can get the information that they need.
And I think that's fantastic. You're kind of acting as a hub, right? Bringing
Yes.
information in from different places. I'm impressed, and that's kind of your love as well, your interest, right? As being a science communicator.
Yes,
Right?
exactly.
And so how do you go about sort of validating the resources that you do add to your database, right? For other people to time into? What is the process?
Yeah, that's a great question. So for us, within our group, what we do first of all is we have to visit all the websites that are coming into us or that we're finding, because we collate them in different ways, whether we ask people to add their information within a form coming in, or we do the work ourselves by out there and looking for these websites. So we have to first of all visit the websites, know what the source is. So, you know, whether is it information coming from the WHO, the CDC, a university, some respected resource or source, number one. Number two, looking to see if the website itself looks legitimate. Is it active? Because I mean, with all this information coming into, it's important to distill what's, you know, real versus what's not. So it's interesting, actually. I have a story about that because there was, so because we're this hub and we have this survey where people can also input their information to be added to the survey, then we have to go vet them. We had one particular example come in with a group in Toronto, and the website looked illegitimate. And so we had to do far more investigating into it, you know, to determine whether or not we were going to add it to the website. So first it started with someone adding it to the website, then another colleague going out and actually asking several people because we were looking at the website. Parts of it looked legitimate and then other parts of it did not. It didn't have information about who to contact, which also made us wonder, you know, was this a site? But after doing a bit of digging and asking around and sending, first of all, they did have a contact us form on their website. After doing that and then receiving information back, then having to go and validate that information, sources and contacts that we had. And I realized that yes, indeed, it was a legitimate website. It just did not appear to be so. And so it can be really difficult within this time to figure out and filter out what's real and what's not. So it requires quite a bit of investigation. So not only sources, but then sometimes requiring contacts of trusted people and getting input from them. Also looking to see the type of information that it's sharing. So is it useful? You know, is it giving accurate information on the website itself? And so that validation is also coming from different sources. So once again, places like WHO, CDC, websites and organizations and things like that. So that's been our process in trying to vet the different websites that are coming in.
And so one of the questions I've always asked, and the other guests, has been the speed of change of information.
Yeah.
So how do you deal with that as things are changing rapidly in your platform? Do you take things down? Are you constantly checking? What do you do?
Oh yes, that's another excellent question. That's exactly we're in the process of doing. And so this, you know, sometimes we talk about this whole platform being run as a startup, right? Essentially, it's like a startup and you're running and going with it as things are. And that has actually been a challenge as well, because the amount of information that's coming in and being able to vet and figure out what pieces of information we want to add to the platform has been a little bit challenging and a little bit difficult. But even having said that, so our original goal was around having people helped with contact tracing and testing,
Mm.
and because that was a huge issue over here. Unfortunately, as we were trying to do that, there's a lot of red tape those two things, and it's particularly because they're more public health related. And so that is more on a governmental side. And so although we want to help, and so many of our volunteers on our platform would like to help, there's a lot of red tape with that. So because of that, we're now in the process of going over our website again. So our website is now just about, our platform is about 2.5 months old. So we actually made it within 6 days and it's been rapidly changing and updating as we go. Very, very exciting. But now we actually are at a point where we have to revisit things on the website and realize that some of our wording and our messaging may need to change depending on whether or not our objectives have had to change because of the red tape that we've faced.
Right.
So that's actually something we're currently in the process of doing.
It's a big challenge, things.
Yes, it is definitely challenging.
Now things are faster as well, right? So
yes,
on the side of your platform, essentially is helping the users sort through the information. You're also doing them a favor in a way, right?
exactly.
So what kind of impact, like how do you assess impact from your end? Like what are some of the things that you are tracking to let you know that this is working or not?
Yeah, that's another good question. So for us, because we are primarily a hub, we've actually started using Google Analytics to decide, what pages are people visiting within our platform and how those pages are doing. So one thing that I found very interesting, and then also is informative for us to know, what it is that people are wanting and needing, is actually those pages of information that we have on the website. They tend to draw the highest traffic right now. Also within our email. So for example, I'm managing the inbox, and the types of queries that are coming in, a lot of them are related to the information. So what we've started noticing is it is that want and need of accurate information or being redirected to the accurate sources that is what is driving people to reach out to us and also visit the website. So those are two ways in which we're sort of tracking impact and feedback, if you will, in terms of information. We are also, like I mentioned before, we have a volunteer database. And so one of the ways in which we're tracking how our volunteers are doing in the places that they have been placed through like feedback survey, for example. So we're having a feedback survey for the volunteers as well as a feedback survey for our clients who are placing the volunteers. So those are a couple of ways in which we're trying to evaluate our impact.
Yeah, I'm impressed that you built this site in 6 days.
Yes, it was amazing. I was also impressed. It's a team of phenomenal people in very different expertise, and so I really enjoy working with them because we are all learning and we're all executing at the same time.
Yeah.
So it's quite exciting.
That is impressive. I'm glad to hear that you have a framework in mind for assessing impact, and from my previous guests, it's always a challenge, right? Trying to figure out.
Yes, it is.
What do you look for, and then or in time, what are you going to keep track? And I'm assuming this will change as well as you.
Exactly. Yes.
So what have been the main challenges, would you say, in doing this? What are some of the main things?
So I would say the number one main thing in terms of information, it would be, like we mentioned before, keeping up with all the information. Information is coming in so rapidly, and even beyond this initiative, just as a indicator, being able to keep up with the information that is coming in through preprint, for example, and then also seeing certain things go through to media, and then specific preprints getting exposure through media which may not necessarily be accurate or accurately represented is something that's challenging. And so then being able to keep up with the information, get the information, and then update our platform, that can be a little bit challenging because we, of course, only started, like I said, about 2 months and a bit ago. So, it's all about having people keep up with that. That's a little bit challenging. And then you also mentioned, we just spoke about evaluation. So for us, it's really important to know that what we are doing is making an impact. And so having now starting up with looking at the analytics for the platform, it's really important to see what people are actually needing and where we're making the most are people going, and then being able to then develop more on that and figuring out, okay, what parts of the platform perhaps needs to be looked over a bit more versus other parts, and what parts probably need a bit more attention versus other parts, just because also our vision is to be able to have it as automated as possible with least minimal physical bodies needing to run it. So get it to a place of automation, as much automation as possible. So that's also part of some of the challenges going forward.
And what's the future?
So the future of it is, like I was saying, getting it to a place of having some automation in terms of the entire platform. In terms of information specifically, we're actually looking, so we have a massive database of volunteers. And so one of the things that we would like to do is to start having our volunteers get more involved with the science communication aspect within our platform. So although we're currently housing links to amazing other initiatives that are doing things like looking at misinformation or having correct or accurate information, we ourselves also want to add content to the website. And so something else that we were thinking about in terms of science communication or information is being able to train and have workshops for people or some of the volunteers who are interested in science communication, have them come on board and actually be able to be trained in it. Because what I think myself and many people have probably realized during this pandemic, the way in which we communicate science, especially in a time like this, is so important. Not only is it to be able to have people know what the accurate information is, but tensions are high. It's accurate and it's important to be able to empathetically engage with people during this time. So that has been a big learning for me personally, but then also if we're going to have people doing that for our platform, we want to make sure that they're trained and well versed in doing that in a safe and empathetic way.
That's fantastic. And you mentioned workshop. I was thinking in my head as well, like workshop maybe, but more so for the users. Have you thought about that? Like training them, especially in this, how do you navigate the sea of information? Because essentially you are, as a platform, are also a piece of data in their
That's true.
Right?
Yes.
But that's something that we've been thinking about as well. I'm curious if you've thought about that too, not only for your staff, I guess, in this case, but also the user base, right? People coming into your site. Any sort of training that you've thought about to do?
Yes, that's a great idea. No, we haven't thought about that. I think that is a little bit, I think that currently may be a little bit out of our scope of where our objectives are, because we do have several platforms right now. We've got about at least 6 of them. So managing that in itself has been challenging, and we've got a lot of dedicated volunteers. So I don't think we're currently thinking about that particular objective, although I do think that's a very important thing to do. Myself, apart from the initiative, that is actually something that I am building, is a workshop around helping people to navigate misinformation, because I have done a bit of, I have done a workshop and a couple of talks about misinformation for COVID-19. So on a personal level, I'm doing that. But in terms of the platform, because we've got so much going on already, I don't think that's of it.
I think I agree with that. So in terms of funding, so how you guys are all volunteers? Is this
yes, yes, we are currently all volunteers. We're all volunteering our time. But we're actually currently building a sponsorship package, and we are looking for sponsors and donors. Because as you can imagine, it is very difficult to keep something like this going with just in kind and everyone's volunteer time. Most people within our team are working, so they have their regular 9 to 5 jobs, and then they're volunteering their time. But then there's some people who are not, and so it's a little bit difficult, as you can imagine, during this time to just be working for free. And so we know that, we're all aware of it, and we're actually, like I mentioned, in the process of drafting up sponsorship packages, looking for sponsors, looking for donors. So yes, if anyone out there is looking at this, we are very much welcoming any financial assistance that you can give. It's important for us to be able to do that, like I said, to maintain this platform going forward. Also in the future, one of the things that we do was not to have this platform just die. We put so much time and effort and energy to building it. We would like to see it become something that can be used in the future. So say, for example, a future epidemic that happens within Canada, and we have already created this platform, it would literally just need a shift in the content, but the platform will be there and up and running. And so as much as we're trying to automate parts of it, other parts of it will still require people, working and having a lot of manpower there behind it.
Mm.
So yes, sponsorship, donations, we are definitely needing funding.
Okay, for those who are watching, you heard our director, Dr. Sankar, wanting to grants, whether it's sponsorships. Is this a nonprofit at this moment?
So you're not officially a nonprofit.
Okay.
So again, we're currently a grassroots initiative.
Okay.
Yeah.
Yeah, but this is the beauty about this. Organically, it will grow and change.
Yes.
Right. So this is fantastic. It's been wonderful to have you. We've, I think, barely scratched the surface here. But the point, I think, again, is to, I want to also go back in the database and look some more in there, right, to see all the development and keep track. And so for those who are watching, please go to this website. It's a great resource. And before I had a random question as well, this is only for Canada so far, right? Data sets you're getting in, or are you envisioning it being global?
So it's currently majority information from Canada, but within our, so if you go to our other initiatives page, and that's actually the page where you can see all the information I was talking about regarding whether it be, scientific information like clinical or research, etc. That on that specific page, oh my God, I just lost my train of thought there. Sorry, what were you asking again?
In terms of the global nature of this project.
Right, yeah. So if you go on that page, you'll see majority of the projects are listed within Canada, but we do have some that are listed internationally. We do have some from the United States, actually. So as more information comes in and we decide how, after vetting and deciding where the information fits, we decide if we want to keep that piece of information from a national source or just to keep it local.
Okay, fantastic. Dr. Sankar, thank you so much. And please join us for our next guest that we'll have soon, and hope to see you and keep engaging with you as well. Okay.
Yes, thank you so much for having me.
Thanks.